another Better Humans at Work, and I am very excited that my friend is here with me today, Dr. Sam. So before we dive in, I'm going to tell you a little bit about Sam here. So she is a DEI strategist with 12 years of professional and educational experience in various industries, including biomedical science and research and public health education. Before transitioning to executive officer at DSRD Consulting, she led the development of the DEI strategy for Goodwill Industries International and supported over 156 retail Goodwill stores across North America. And before that, Dr. Sam served as the Equity, Diversity, and Inclusion Principal Strategist for the National Institutes of Health. And then in her role as Principal Strategist, she managed the Black employee portfolio during the global crisis of the COVID-19 pandemic. Busy. Okay. And Dr. Sam also graduated from the Educational Leadership Doctoral Program at UNE, where she received her doctorate in education with a concentration in organizational management, and her research focused on the effects of racial microaggressions on Black female government workers, work performance, and methods to reduce microaggressions in the workplace. So you busy girl, but I'm so glad you're here. It's so funny because just as like quick insight for everyone else, I started following you on LinkedIn because you have a pretty strong LinkedIn presence, and I was loving what you were putting out there. A lot of it resonated with me, and then I don't remember what happened. I don't know why. I don't know how you saw it. I think it was something John Graham and I maybe were talking, but one day I looked at my connection request and you had I was following you and you reached out to connect with me, and I was like, oh, I've made it.
I think it was your book.
Oh yeah, it was the book.
Like, ooh, I like this.
So that's so fun. So yeah, I'll just say welcome. Thank you. Excited that I now can consider you a friend and that you came on the show with us today.
Yes, I'm happy to be here. Before we hopped on, I was saying we both love data and research, and so I'm glad like I can meet and connect with someone in the DEI space who also loves data like me.
Yes. No, it's so funny because I say this to people all the time. When anyone talks about diversity, equity, and inclusion, they're like, oh, it's fluffy, it's feelings, it's all subjective. And so, yeah, whenever I find other people who are like, no, it is not. And here is why it is not. I love that. So you're one of my peoples. But I read your quick bio. Well, not quick, but I read your bio. But tell us a little bit more in your words about, your journey and how you got to where you are and how things are changing, because I know there's a lot of changes going on with your company right now.
So my journey to the DEI space is nonlinear. I say that all the time. Mm-hmm. I started out in biomedical research. So I was a biology major undergrad. I thought I was going to med school, and I'm Caribbean. So I feel like if you're anywhere across the diaspora, your parents want you to either be an engineer, a doctor, a lawyer, something like that. But I naturally like science, so it wasn't forced. I, at like 12, said, I'm going to be a pediatrician and majored in biology, did a ton of research. And right before graduating, I realized, not right before I graduated, but I always wanted to change the systems that influenced how people showed up to hospitals. I didn't want to just treat them and like send them back, because my goal was to work in underserved and under-resourced neighborhoods or communities. And I'm like, but it just didn't sit right with me that, they'll be getting healthcare, but they go right back into the same situations.
Yeah.
And I kept telling my physics professor that, and she was like, you sound like you might like public health. And I'm like, what's that? And literally my last semester of my senior year of undergrad, I Googled really quickly what public health was. And I was like, yes, community health. Yes. Maternal health. Yes. And I applied to a bunch of grad programs and got in, took the GRE on a whim, and I got in and changed my life forever. I focused on like health equity through my thesis, where I explored like the connection between the prevalence of miscarriages and marital status. So trying to see if women or people who have children being married, if that influences their likelihood of having a miscarriage. Mm-hmm. And of course, there were disparities and inequities across different racial groups. And I was like, yeah, anyone could assume that this was going to be a thing, but I left it there. And after that, I went into accreditation where I worked at this organization that accredits public health schools and programs internationally and across the US. And through that is when I really started to incorporate like cultural competence and diversity and inclusion into the work that I was doing, because I worked to develop the standards that related to, at the time, it wasn't DEI, it was cultural competence and like diversity and inclusion into accreditation for public health schools and programs. And I was a consultant in helping the faculty members and the program directors and the deans of these schools understand why they needed diverse representation of faculty so that the students in which they teach can feel like they're being represented and understood when they're going to class, like all that stuff. Yeah. And so in the midst of that, I did my dissertation, the research that you mentioned about racial microaggressions and how that influence Black women's work performance and how they show up in the workplace. And I was like plunged headfirst into DEI and data and research. And from there, it's been up. I've been developing DEI strategies and focus using a lens of equity and being data-based in the work that I do in this space. And yeah, so I became the director, and in the midst of doing that, I decided to transition fully to be a full-time entrepreneur. And I kind of stumbled around and figured out what exactly I wanted to do in my consulting firm. And I realized that there was a huge gap in education and best practices. I don't like that term because I feel like there are never any best practices. It's just the ways people have figured out how to do stuff, and that can change. But anyways, there were some gaps related to developing DI strategies. People were calling them like DI programs, which no shade, that's fine. Right. But that means something different to people depending on like their field, what they do on a day-to-day basis, their own experiences. And there was no consistency I was seeing. And when I was first developing DI strategies, I noticed there was nothing out there besides the global benchmarks. And that didn't really tell me much. It just gave me like a ballpark of like some sort of framework, but then I had to still figure it out. Luckily, with my research background and then my public health background and understanding like SMART goals and strategic planning, because to affect change, you have strategic planning skill sets, and it kind of ties in with the research methodology process. Yeah. So through all of that, I somehow concocted this framework and I started using it to develop strategies. And I've just been doing that ever since. And so I started teaching people how to do that through my program, DI Blueprint.
DI Blueprint.
Yeah. And that's been great. People have been finding it really helpful and valuable. And recently I decided to shift my focus a little bit. So instead of doing DEI related work, focusing on the people that do DEI related work, because there was also a gap. I started burning out, and I realized that other people were burning out as well. And we didn't have a lot of resources for us. And so I created DEI Offload as a space to promote prioritizing rest and mental health, and also providing access to some of the educational stuff I mentioned and just community in this space. And now I am exploring the focus on DI practitioners a bit more in terms of business automation and streamlining business operations and making sure DI consultants have their business operations streamlined so that they're not like overwhelmed with running their actual business and they have time to both rest and do the work that they love. So yeah, the summary overview of my timeline.
No, and it's so much, and I love each part of it too, because every part is so important. Having that foundation of just how, as practitioners, are we doing this work? So I've seen people talk about DEI Blueprint. We actually had a client. I don't know if I ever told you this. Well, actually, a prospect. But we had a prospect at some point who they were like, "Oh, I know somebody who went through this, and like they have it set up kind of like this. Do you do anything like that?" And it was screenshots of like something you had shared on LinkedIn. And I was like, I mean, yeah, like one, this is foundational. Like, yes, that we follow something similar, but I was like, you can also like chat. But I was like, you could chat to Sam, but then I was like, well, Sam's not chatting to clients right now. She's talking to practitioners. So all this to say, though, your message is getting out there, and we do need some consistency in just a matter of what's the right way. Like you said, there's no best practice on the outcomes of all of these things, but what are some of those just foundational processes that we should be thinking of when we do this work? Because sometimes people are like, oh yeah, I think DEI is cool, I can be a practitioner, and they just start slapping stuff up there, and it's like, hold on. Or they struggle, right? They're like, I want to do this work, and now I'm trying to reinvent the wheel, and it's like, no, there's some help out there to get you started off on the right foot. So I love that side of things. And then the community piece. So when I saw you start advertising for DEI Offload, I looked to the side because I have the tab open on my like browser. It's always open just in case. I listen for the ding. But I love that too, because I feel like I'm more and more, and I mean, there's always going to be some people who don't have this mentality, but more and more I'm finding people in this space who really just want that community. We're itching for it. Whether you're internal or external, you want to find people who are doing this work. You want to talk about your successes. You want to have those people who are going to, gas you up when you're doing well, but you also want to talk about where you're struggling and find out what they've been doing and what could work better for you. And so just having that space and that community, I love what you're building with Offload. I don't know if you saw me post, and I saw your post today. I need to post it and offload more and get people to come. But we did an event down here a couple weeks ago in Raleigh where it was just networking. It was like a little mixer. I had a lot of food. People just came and they could talk. I had a few like cheesy little activities where they could get conversations going, but it was just getting people together who can talk about this stuff, get out of the house for a little bit, have a few drinks. It was such a good time. And so I think we're going to do it quarterly. I'm really excited about that.
Oh, I need to talk to you about this because I wanted to do something like that, but that's just not my personality style. I'm going to be very honest. Like, yes, I built this community, but I am not a community manager at all. Like, I don't even want to say introverted. I'm just very like one-on-one. I'm not a group person, social. No. So, and I know there are a few people in DI Offload that kept saying like, is there anybody in North Carolina? So that would be so cool if we could just like say, Sertrice is already doing this. You should link up with her and like take some selfies and post it and just, like, for
Yes, I'll tell you, because I guess I'll let it slide here now. No one really knows this. I haven't put it out there, but we're definitely doing a second one. It's going to be November 3rd. So I need to start advertising, but I'll tell you about it. And yeah, it's good. It was like 2 hours just hanging out at a local co-working space here called the Loading Dock. They co-sponsored the event and let us have it there. So it was really nice. Yeah.
You're nice. You inspired me. Maybe let me not let me think about it. But yes, I would love to have something like that.
Yeah. Well, and like I said, we could talk. Okay, we'll pull this off here. Maybe y'all stay tuned. We might be having like a DSRD / Mattingly mixer down here. We can talk about
that would be cool.
Yeah, it'd be so fun. But all right. Well, okay. So this was good learning about you. And like you said, I love that we both connect so well on the strategy piece and the data and things like that. But one question we always ask people when they're on the show is just, what, in your opinion, do you think organizations, or, take that practitioner lens of people working with organizations, what can they do to help create better humans at work?
I love that question. I loved how you frame it, because oftentimes we've been seeing a lot of stuff come out about like what employees can do to navigate blah, 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 blah. And it's just like, we shouldn't even have to navigate a lot of the stuff that we have to navigate. Like the systems and the processes and the culture should be safe enough for us to just show up. Yes, people have things they need to work on and they should go to therapy to work on that. But the culture should be a little bit more safe. So the first thing I think is creating psychological safety. And I know that word has been thrown around a lot, but to me, psychological safety is rooted in transparency, accountability, open and honest communication, those three things. And I feel like if leadership models that behavior and takes the stand to hold their peers accountable, against like certain behavior, like microaggressions, for example. And also is just transparent about how they're showing up, about their policies, how they're making decisions, and then communicate that. And also give
Mhm.
employees a space to ask questions and be involved in the process. That is a start. And then I would say, I can't see who put that in the chat,
Oh,
but
that was
please.
me.
Oh,
I was recognizing.
um, yeah, I think that's a start. And then having that foundation, I always say have a DEI strategy. I always say that because it's a plan. It's a plan for how everyone at the company is going to uphold aspects of being equitable and inclusive to promote like diversity in the workplace. But
Mhm.
having those aspects of psychological safety is a good foundation so that you can create the strategy. And if you have those tools already, creating the strategy is that more, it makes it more simpler, not more simpler.
Yeah, I'm with you. No, I think that's such a key point is that the strategy one does matter because I do know there are some people who are like, DEI isn't a strategy. I have a good friend of mine. We joke about it. Jared, he hates saying that, but to an extent, there needs to be a strategy, right? Just like
Mhm.
anything else. I always love to compare it to something like with your finances. You're not just going to be
Yeah.
like, oh, we're going to naturally make money. No,
Yeah.
you're gonna have a plan. You have budgets, you have goals, you have targets. Same thing here. Yes, it should naturally happen. Yes, it's ingrained in everything you do, but you still need to have this strategy that you can fall back on, that you can rely on, check in on to hold yourself accountable. So
Yeah.
that's key. And then but where you started with the psychological safety, the transparency, the communication, all these things that are around that strategy to make sure it
Mhm.
actually happens. Because
Mhm.
without those pieces, it's just words on a wall or words on a form, a document, and so that
Mhm.
stuff really helps it come to life.
Yeah. I was gonna say to the point about DI isn't a strategy, it is not a strategy, but you need a strategy to be
Mhm.
intentional about being equitable because though everyone says, oh, we want it to be ingrained in our operations, it has not been for all these years. So how you think it's just gonna magically become ingrained? You have to plan for it to
Right.
shift how you have been showing up. You don't just say it and then it happens. It's kind of like I always compare doing this work to like relationships, having
Mhm.
relationships in your interpersonal life. If you have a disagreement or if your partner or your friends don't trust you, you can't just say, well, we're going to have a good friendship now. No, you have to find out why they don't trust you, what you did, what your role in it
Mhm.
was, and then what they need to create that trust, and then be communicating how you're making changes to establish that trust. It's the same thing.
Yeah.
And people forget that. They think because businesses are businesses that they're not humans running the business and a part of the business.
Yes.
And so, yeah, it devoids the humanity out of working, and that's that's our downfall.
Yeah, no, remembering that human aspect is so key. And I will say, to some extent, like you said, some people also just need to deal with how they handle interpersonal relationships as well. And so it may be a
Mhm,
big ask asking them to figure out how to do it as an organization when maybe there's
mhm.
something they need to sort through. That was something you said earlier that I was like, well, and that's some people just need therapy, and
Yeah.
that's something that we as a society are still we're in a much better place than we have been in previous years, but there's still a lot of stigma around mental health, and
Mhm,
people don't always make that connection between mental health and DEI. One, on the plane of when you're in like environments that are not inclusive and not equitable, how that impacts you and your mental health.
mhm.
But also, I will say, people forget about the fact of if you are not in a good place with your mental health, that is going to impact your ability to be inclusive and equitable.
Mhm.
So you need to figure that out too. And then you'll realize how you can either be better, or maybe this stuff will start to sink in the first place of, oh, now I get why people are talking about DEI and how I can
Yeah.
better contribute.
Yeah, I agree. That's one of the reasons why DI offload is so important to me because I felt like that was just missing from DEI in general. Like whenever
Yeah.
people talk about DEI, it's either like the business case or anti-racism training, or just training in general, or having speakers, or like celebrating commemorative months each month. And it's just like, yes, those are all elements to doing this work. But what about the psychology behind it? Like, how are people even showing up? Like, how we need to address that piece. And then the marginalized groups who need equitable environments, they have healing that needs to be done. There's trauma and trust that needs to be restored, and it's really complex. And so it kind of frustrates me sometimes when people try to minimize this work as something that's like voluntary, or like, I'm just so passionate about it, so I'll volunteer my time. Like, no, that's not what this is.
No. There are a lot of layers. There are people who are educated in the different layers, right? Because I wouldn't sit here and say I can talk to the mental health side. That's not my specialty, right? So that's the other thing, is bringing all of the right voices together to get the progress that you want to have happen, and paying all the people who are helping you get there.
Yes.
But I am looking at the time, and I know we want to keep it a little short, so I'm going to get ready to wrap us up. But I just want to thank you one more time for being here. It's always fun chatting with you and just hanging out. And so I'm glad you could come. I am going to drop in the comments a link to your website. If anyone's interested, if anyone's interested in DEI offload that we were talking about, or I know I think you have one more cohort, right, of Blueprint that might have some spots open before you.
Yes. So the full program itself will be closing at the end of September. But people will have the access to, or have the ability to access just the modules only after that. And there's going to be some like transition period. But if you sign up for my newsletter, you'll be in the loop with everything that I do.
Yes. So definitely be sure to follow Dr. Sam on LinkedIn. Check out her website. I dropped it in the comments. And thank you again for being here, Sam. And we'll talk to you soon. Bye, everyone.
Yes, thank you so much.